best case scenario to an addict getting well, or in the family context, is everyone to take responsibility for themselves. Not always, but oftentimes the addict is the trailblazer to recovery. Everybody in the family is suffering.
Sure.
But the addict is oftentimes suffering the worst. Being compassionate yet firm. One of the kindest things you can do for a person is say no to them. Boundaries are huge.
The pain is trying to process itself out. When you try to stuff it down or escape it or whatever, the pain basically says, I don't think so. You have to deal with me. This is our third segment with Mike Kuklica. He is one of our addiction and recovery therapists at Life and Purpose Behavioral Health. We're excited to have him on again. We've been doing a segment on addiction and all sorts of things that come along with it. And so today we're talking about family and addiction. I think it is a very important conversation to have, and I hope you all enjoy. I am happy about this episode because I think it is something that is the pink elephant in the room but doesn't get talked about, and that's family and addiction. Right. I think it is such a complicated, to me, and maybe you can you'll be able to kind of simplify it a little bit more, but I would imagine if it's complicated for me, it's probably complicated for everybody that's not in the field listening to this. Family is so impacted by people struggling with addiction. They have to be part of the recovery plan. And we have to figure out, there's a lot of dynamics that complicate that.
That's right. And there's a lot that we don't see in the office.
Yeah, right.
That's what we need to be cognizant of.
And that makes certainly things hard as a clinician, where if all, you know in your own mind that there's a whole family element to the person coming in to be assessed for an addiction issue. That's right. But you only get that one version, which is the client. Definitely challenges things if you never see the family.
Well, let me give you just a brief background that's helped me to become more aware of this dynamic, of the family aspects of addiction. As a professional, I worked up north at an agency, Muskingum, Guernsey counties, and I had the opportunity to basically, I would say, apprenticeship under his name's David Grove, and he was a social worker. He's a social worker that specializes in family intervention work, and we developed the agency developed a program. I had a lot of good mentors back then.
Sure. As
far as family goes, that I learned a lot from, David Grove being one of them. Another gentleman by the name of Phil Washburn, and a colleague of mine, Dr. Charles Rice, and I was the least formally educated person on the team, and professionally in that aspect, the least experienced. And so it was a really awesome opportunity for me professionally. I learned even more from the families I had the opportunity to work with.
Oh, absolutely,
And there's always, more to learn, and it really was, we had clinical consultation with David Grove 3 hours a week, every week. And so instead of learning in a classroom, I learned sort of in an apprenticeship way, and I'm very, very grateful for that. Going into the homes, I learned rather quickly that there's a lot that we don't see at the office.
Yeah.
There's a lot going on that doesn't come to light at the office.
Does that shape how you approach them in the office in a way?
Today I now have more of an awareness that, I've learned what questions to ask. There's probably a lot more going on at the house than I'm aware of.
Yeah.
And so it's helpful to just go to the house.
Sure.
In
the program you were talking about, you were in home. Those were in home. That was an in-home program
for the most part.
For the most part.
Yeah. But the challenge can be, and it's often very helpful to get the families to come to you.
Sure.
And working with an adult client, in the work that we're in, we have to get their permission, and they have to help bring their family in.
What is some of the complication with getting permission from the adult client to bring family in? What might be things that might get in the way of that client being comfortable bringing that family in?
There can be many things, and some even unconscious, but they might have a fear of being ganged up on. they might not want the clinician to see right off the bat.
Right.
And we have to, really gain some trust there so that they know we're not going to put you in the hot seat.
Sure.
We're your advocate. And we're not going to come at your family members either. And which sometimes
establish an element of safety in the room,
which sometimes does happen. Family members get alienated,
sure,
vilified by professionals, and there can be an uneasiness about bringing everybody to the table as well.
Yeah, well, that's a lot of stress in the room. I mean,
and if the
tension or uneasiness or anxiety, because that's a huge unknown, right? For the family and for the client. Yeah, I know you're saying that things are going to be okay, but I truly don't really know until they experience it, right? Especially when it's not in their comfort zone. So the office isn't a client's comfort zone typically, like a home might be.
That's right. And if they have a good alliance with the client, if they're used to being scapegoated in the house, then, and if they think that you're going to help advocate for them, sometimes that's a way in.
Because I would imagine that at least in my experience, that just like the addict is not going, I really, grew up in this world just wanting to be an addict. That's right. The family is saying pretty similar things. Everything I'm doing from a place of, I want my loved one to be better, to get better, to be healthy. They want a positive outcome, but they play a role in the dynamic of that person's addiction.
That's right.
Don't you think? Or is that,
even though oftentimes the intentions may be good, or they're trying to establish harmony and peace in the home,
right?
But because of the addiction, they've, perhaps the addiction or the disease served a function in the family at a particular time. Okay.
Sure.
And the families, they've become stuck in patterns. I've learned that.
Sure.
And how far back do these patterns go? Do they go back to, that's where we talk about grandparents and everything like that. So
how they were raised, how their parents were raised, the environments that they grew up in.
Right. Where did this problem begin? When did it begin? What role did it serve at one point in the family? What role is it currently serving? I had an IOP up north twice, and she was also in inpatient treatment before. She had lived on the streets of Dayton, Ohio, heroin addict, and her mom and dad had custody of her two boys, okay? And so inpatient treatment wasn't working. Legal consequences, that wasn't working. IOP twice, that she still had not been able to maintain any length of sobriety. She agreed, and the family agreed to work with my colleague and I, Charles, and we started having family sessions at the office. When we met with the parents, we would meet with them individually first. When their daughter came in, she would sit in between her parents. The first big change that we saw was we asked, I think it was three or four sessions in, we asked the mom and the dad to sit on the love seat, if they'd be willing to sit on the love seat together. I had a love seat in my office at the time. And when their daughter came in, just the look on her face, it was just shock, but then she was just happy, and her parents were even holding hands. That brought to light something that we needed to help her parents in order to help her. And for some reason,
she was trying to keep them connected or together or in harmony. And then because she couldn't necessarily achieve that fed her use.
And what we found out was the more that we helped unite the parents,
right,
that set the stage for her getting well. And we just continued on that trajectory. And today she has custody of her two kids, and she's independent from her parents. And she works in the substance abuse field now. And this is a particular case where it's obvious that if we hadn't brought the family members in, that was just the biggest factor to her getting sober, was bringing her family into the treatment.
Yeah. The problems were rooted in that family dynamic pattern that you were seeing. And so when people call it a family, and wanted to clarify your term, dis-ease,
right?
Not disease, but dis-ease. The family, there's something disrupting the family dynamic.
Yes.
Regardless of what the cause is, it's disrupted, it's off balance, it's the addiction serves maybe some role in either coping with that or
right,
functioning that. Like, we almost kind of see, like, do some of the patterns like my use brings them together, whereas if when I don't use, they don't come together, right? They distance themselves, they whatever, or if I use, that's when my parents show me the most love, or and those are typically unconscious patterns. I mean, because she didn't know.
No.
That was a very unconscious pattern that she had no idea about. And it wasn't until she saw her parents together holding hands that was able to be brought out into the conscious memory or conscious experience.
That's right. That was really the beginning, the watershed moment of her getting well. Yeah. Honestly, in the whole family getting well.
What was it about that one that really stood out to you, or really kind of made you, I need to talk about this one first?
This young woman was the sick one, right? She was the identified, she's the one with the problem, right?
Sure.
And we came to realize that the whole family needs help. In some cases, I've come to the conclusion that the person presenting the most symptoms is not always the sickest person in the family. Whether a person grew up in an addicted home and then that translated into their nuclear family, or if their son and daughter became addicted for whatever reason, we don't, whatever the why is. And then the family members, in order to help cope with this, whether one family member becomes more controlling because of the chaos of the addiction in the house, that usually keeps the addiction going.
There's a old mentor of mine, Nick Long. We used to talk in a training called Life-Based Crisis Intervention. He called it we were talking about conflict cycles and power struggles between staff and kids, but I think this is relevant. And he would call it a dance of disturbance. Okay. So there's this dance that's going on, and everybody's pointing fingers and throwing blame elsewhere. But there's no way in a relational context to it being only one person's problem.
That's right.
And it also can't be one person's solution. I mean, there's just no way that you can, because we even see that when, and this was, my early education in terms of addiction and family. A family, people kind of assume certain roles in the family. Yeah. Related to that addiction. So there's the scapegoat, the joker, the appeaser, not the appeaser, but the enabler. Thank you. Yeah. Man, I think I'd remember that one. But, and so when if that person went away and came back, in recovery and clean and everything like that, that actually disrupts the comfort level of the family, because those roles no longer become important or relevant, because that person doesn't need that anymore.
It can be a real shock to the family.
Right. It disrupts that equilibrium. And so then you start seeing behaviors in the family that actually feed relapse. What strikes me is there is a lot of fear and anxiety in terms of family engaging in treatment, because of all the things, those patterns that come out are pretty scary to deal with.
And what I've seen is family member who is most vocal about the person getting help, the person gets sober, and that person, it seems, doesn't know quite how to handle the change. This sickness, if you will, played a role or a function in the family of some sort. I think the framework is it helped the family at one time, perhaps, to achieve some sort of homeostasis. Right. But it's
how they started coping. But then they started getting a sense of purpose in that person's addiction, or some maybe unconscious value in it, or reward from being able to make people laugh and ease the tension, be the overachiever and accomplish all these high grades and achievements. Person in addiction typically has the biggest spotlight on them, and so people feel maybe lost or set back or, in their family. But then once they assume those roles, there's more purpose and value to their world. Right. And so they end up, they don't want to lose that.
Right. And a lot of this is on, can be on the unconscious level as well.
Absolutely. Yeah. And no one's consciously saying, I want to be a joker. They just tend to, that's kind of fits their personality. And then they made someone laugh one time and it was rewarding. So then they keep doing it. And then those things just develop that way. And
then you mentioned also blame, and how that fits in is, from what I've seen, the best case scenario to an addict getting well, or in the family context, is everyone to take responsibility for themselves, which, how do you get the whole family to do that at once? Oftentimes, not always, but oftentimes the addict is the trailblazer to recovery. And I mean, the other family members may or may not ever, get into recovery. If they work together, like the case I presented, wow, it was everyone working together here, and we were able to bring everyone to the table. And oftentimes, if you're able to get everybody there, you have a pretty good opportunity.
Sure. And whatever their mindset might be going in, like if someone feels forced, or if they feel, no, we're here to figure this out, what kind of that mindset is. But I would imagine that, because you mentioned trailblazer, oftentimes those patterns aren't as maybe noticeable until the person's clean to a certain extent. Right. Or so those patterns start to really,
they've had the spotlight.
Right. Mm-hmm. So the patterns really start to be noticed in other family members because of that person being clean and disrupting the equilibrium.
That's right. And so we have to help the family establish a new equilibrium, really. That's what it comes down to. We got to look at the structure of the family. We have to assess that as well. And then, even peripheral family members that are who else has influence in this household?
Sure.
And oftentimes, when I used to go to the home and be a knock at the door, or somebody's in the next room, and you realize, okay, there's some other people here that we need to take into consideration,
right?
And see what kind of
other elements going on here,
right? What do you see, Doug, as similar with your trauma work in families in regards to addiction?
I think the similarities, especially working with kids in addiction, oftentimes the trauma leads to a lot of challenging behaviors that really exhaust the family dynamic. There is elements of, they have all these expectations about this person that this is the way they should be. As soon as you start seeing some type of progress, then we're like throwing everything back in, like, oh, now you can do this. Now, and then it kind of overwhelms that person trying to recover from trauma, leads to a lot of disruption and problems again and fallback. Both the families in both situations have to understand that they are part of the solution in the way that they relationally interact. Oftentimes the way you parent or the way you do certain things have to adjust and change based on the dynamics of how trauma impacts our brain and body and what they're going to be receptive to and what's going to be helpful for that person. So there does have to be elements of, how do I work? How do I understand the dynamics of the impact of this person's trauma, and how can I be most helpful for them? Not what I think will be helpful, but like when we did trauma work with kids, we would always have a family session at the end. Well, I mean, for the most part, if they had family to present to. If they didn't, we would, present to a staff member or something like that. We need to provide education to help the family understand how the trauma has impacted them and what helps. And so that they can provide that help. That requires ownership of that to be willing to do that. And sometimes that's not easy. Okay. Because that may be different than the way they typically respond. Okay. So you're asking them maybe, be less micromanaging of the person's academics, or, just kind of, you're asking them to do things that necessarily doesn't make sense. We're going to get there, but we're going to take a different route to get there. The end game is still the same.
Okay.
The outcomes are still the same, but we have to take a different road, a different path. And I think, the end game is the same for what, their intentions of what they're wanting to accomplish are pure and positive, but the road they take is not helpful.
Right.
It doesn't get them there. It actually throws up a lot of roadblocks and detours.
Right.
And so, and we can often re-traumatize just as much as we can not re-traumatize the person struggling with addiction, but lead to a relapse. Like we can trigger a relapse. Not be the cause of it, but we can certainly trigger the relapse. There's a dynamic. We all affect each other.
That's right.
We're social beings. And so to think that we're not a part of those dynamics is, I think other similarities is families are often lost at what to do and how to help. And I think that's the same for somebody who's, has a son or daughter or a loved one that has a lot of complex trauma and is struggling so much because of that. We get lost.
Right.
And we can kind of absorb that unwell experience.
I can relate with addiction. You talk about the example of a parent who has fallen into a micromanaging kind of way. And oftentimes you can run into that in families of addiction. There can be a parent that's well-intentioned, but they're not aware of how to solve this problem. They're trying to make things right, but the way that they're going about it, and over time they get entrenched in that pattern. And working with families, just for me, being careful how I approach that person is important, because there's oftentimes a lot of blame going on already, and just being able to persuade the family members or the parents to take responsibility for their own part, and being open to trying a different method, a different approach, and then really helping influential people in the family to unite and come to more of an agreement, which can trickle down to the identified person with the problem.
In the world of evidence-based practice and all the things, that's driven by research, and research is great and all, but ultimately it comes down to the person that is trying to implement it and the timing of that intervention. Does it match up with what that person can developmentally handle?
Right.
So, we can, the way you implement that particular model that you were working from would be different than the way someone else might implement it.
Right.
So although there are dynamics and interventions and structures to the way you guys intervene, there are elements of the person that really plays a huge role in the therapeutic effectiveness of an intervention. Because, you can find evidence-based practices all over the place.
Right.
So what does that tell you? Yeah, it's probably not necessarily the model that is the true measure of that success, but the person delivering the model and the right time of delivering that model.
So many factors.
Because just kind of going back to what you were talking about with your family, there's going to be moments where you're trying to bring that family in, and they're too sensitized to that. They can't. Either the client is too sensitized to the fact of having family members in, or the family members are too sensitized. So you could try that model and force them in there and try to do this evidence-based practice, and it'll blow up in your face because you didn't pay attention to the developmental needs of the family.
That's right.
And that's the same thing with trauma. When do I choose to do a particular intervention? Be wary of just demanding what evidence-based practice you're using, because that's not... That doesn't guarantee you success. I'll be honest, I did a lot of family work with kids, and it's challenging. I've had some door slamming, blow ups, in my family sessions going, and I had great mentors too, going, wow, my mentor would be like, wow, he sounds like he really accomplished a lot. And he wasn't trying to be funny. Cause we were able to, and I was describing a situation where it blew up, but then we were able to bring him back together after the blow up. and have kind of a breakthrough, being able to kind of identify certain things and be able to break that, through. So the other aspect is to be an effective therapist, to be effective at helping in recovery. We can't be afraid of problems. We can't be afraid of disruption, because that provides the opportunity for healing.
That's right. A relapse can be an opportunity. I've worked with families where 1 or 2 sessions, they fixed it. The family
just fixed
the problem in the 1 or 2 sessions. That's all that was needed. I've had other families where it's ongoing, and we've had marathon intervention sessions, and that's led to success in treatment as well. Just like we would meet a client where they're at, we need to meet the family where they're at, and be careful of not jumping to conclusions. With the family assessment, it's ongoing. We need to. There's so many factors to be cognizant of.
And oftentimes you're doing an assessment, and you think you got it figured out based on that assessment, and then it's not working. Nothing's working. And you were like, okay, I might have missed something.
That's right.
And then all of a sudden you uncover something that really kind of seems to be the source of the dis-ease.
Right.
And until you can get to that source, it's hard to course correct to figure it out.
Looking for strengths in the family and in individuals, but in the family as well, is looking for strengths in order to find solutions to the family problem.
I mean, ultimately, if you don't look for, strengths provide the opportunity.
That's right.
To find your way onto the different path. So you can use those strengths to get to where you need to be.
That's right.
And so you do need to take there was a resilience author on resilience, Goldstein. I think his name is Goldstein. It's been a while, but he would talk about going on talent hunts, like just as much as you can. We're all good at identifying problems, but we have to, go on a talent hunt. We got to find what are people's talents, and sometimes the talents are, found through the problems.
Right.
They just require a little tweaking.
Working with adolescents, for instance, a mother will be bringing the child in for therapy or to see the psychiatrist or whatever, and case management, and there's a team working with this individual, and I've seen dads or the father figure get alienated from the whole process, when in fact the father's the key to the family getting well here. And we've got an adolescent that's having problems, and they're the identified patient. Why is the father getting vilified, or why is he getting alienated, or why isn't he just not even, why is he being excluded from this process? And so we go into the home, and we're able to work with the father and persuade him, and that's revolutionary oftentimes. But I've seen that. I've seen the exclusion of men in the lives of these kids that could be involved.
So our brains tend to, we're meaning makers. Our brains are meaning makers. So we're trying to make sense of and find meaning, or find understanding of why certain things are happening. And so I think maybe just as much as the addict can be identified as the problem, so can the fathers or the men, or so can the moms. I mean, there's moms that are get blamed for a lot of things too, and are the reason why, or and parents ultimately with a lot of kids who have challenging behavior get blamed and are the reason why kids are the way they are. There is I think a cultural tendency to find blame, to create meaning of why something, to make sense of why something's happening. But you bring up something that I think is really interesting, of a different take to it, is what if we focus on patterns and not who is the cause or who is the problem, but let's throw out the patterns, because when we talk about patterns, that's not necessarily calling your character a defect or identifying someone as being bad, but the pattern isn't working. The pattern is the problem, and we have to figure out a way to correct that pattern.
You can find that there isn't an influential person in the family, whether it be a grandparent or a parent, that is sometimes siding with the addict, the adult addict, or siding with the problem adolescent. And that's another pattern that needs.
Yeah, and sometimes I think the dynamics have been established, and it's not necessarily purposefully done or identified, but whereas maybe, the father is alienated to begin with because of, conflict between the spouse and, and so that person becomes actively resistant to the process, often alienated, which is really the result of a self-fulfilling prophecy. No one really cares or values me. And so then I start being resistant. And so then they naturally get excluded because he's too resistant. And then his private logic is, see, no one values me, so what's the point? And so it's this vicious cycle that plays out the exclusion.
So you can see how revolutionary it can be if we can get the mother and father in a situation like that you mentioned more in alliance, where if the mother's aligned with the kid, breaking that pattern, becoming more aligned with the just revolutionary to the family.
Sure.
The adolescent or identified patient
cuts through the tension.
May resist it, or they may respond immediately to it.
Right.
Favorably. So
the resistant aspect of it creates an opportunity. I always like, when I think about family therapy and just doing family work, is I am more of a facilitator than an interventionist. I'm the one who kind of puts up the mirror and highlights what's happening and then lets them process it out.
Okay.
So it's kind of like if they're yelling at each other, and so what did you guys notice happening here? Or what was that like for you when, versus, so we used to have, and I remember when we were learning a particular family therapy model, structural family therapy. And I remember it was when I was working in a residential program. In residential, we were managing groups. It's all like, don't do that. You're, blah, blah, blah. And so we were always about stopping behavior. Right. And so in family therapy, the staff member that was receiving this consultation would bring up examples where the kid would mouth the mom. And so then the family therapist is going, don't you do that. You don't talk to your mom like that, which is actually very counterproductive.
Right.
Because you are solving the problem and not highlighting the dynamic of this pattern of kid yells and demeans the parent.
Right.
What does that dynamic mean? What is that pattern servicing?
Right.
And how do we get through that pattern?
Yeah. How can we help the parents resolve that?
Right. Yeah. Right. And so it's more of facilitate. So I remember clear as day that the mentor, being able, to kind of highlight that is our job's not to tell, parent for them.
Exactly.
Our job is to paint the picture, play the movie out and see what they notice about themselves and how they recognize the patterns and what it does for them. And so I would imagine that that's very similar in the addiction world too. It would be very easy for us to kind of, okay, don't do that.
Family therapy and trauma, and family therapy with addiction is oftentimes can be caused by trauma, and it's a person's. So that's where this all can kind of come together,
right?
As far as
absolutely, and yeah. And I think so similar is, okay, I think family, like if my kids, heaven forbid, like, struggle with addiction, I would probably, even though I could probably go back to my counseling books or whatever, I would need help in how do I respond? How do I help?
Right.
How do I navigate this really complicated world? Because I don't want to create more problems, It's harder for us to see our own struggles and issues and patterns than it is to know somebody else's. Right. Teachers' kids or the psychologist's kids are always the worst, because you almost don't recognize your own patterns. So you need, regardless of whether you're an expert in some field, you need somebody to kind of support and help those dynamics, because you'll be unaware.
One thing I've learned, and I tend to believe that the solution is oftentimes simple.
Right.
You know, we just have to be aware of the complexity. My colleague Charles and I were referred a case, and the presenting problem was, I think the girl was like 10 or 11 at the time, and she was just refusing to go to school. She was an only child, refusing to go to school, refusing to go upstairs once she got to school, and she was out of school by the time we got the case. A husband, a wife, and a daughter living in the home. And we went into the home and gaining rapport with the family and everything, and we found out that the mother was agoraphobic, and I think they were both probably in their 30s at the time. And the father stayed at home. So mom and dad were home all day while the kid was at school. You know, everybody has a story. What happened? Were you always agoraphobic? We didn't use that term, but were you always this way? No, she explained her upbringing, and there was a lot of trauma there. And in high school, a very traumatic event happened to her. The doctor's solution to this was to start prescribing her Xanax. And at the time, it was the 0.25 low dose Xanax. Fast forward about 14, 15 years, she's now prescribed, at the time that we got into the case, 4 Xanax bars a day. And she took them as prescribed. She didn't go out on the street to get more, but she was dependent on them nonetheless.
Absolutely.
And I asked her, I said, is your anxiety better today? You know, Xanax is supposed to be the medical solution to anxiety, right?
Right.
She conceded
I was able
no.
to identify it, yeah.
You know, her anxiety was exponentially worse. I mean, she was to the point where she couldn't leave the house.
Yeah.
And still on the highest dose at the time allowed to be prescribed of the benzo. She showed tremendous courage. I mean, she worked with Charles and I, and we worked with her doctor at the time to taper her off gradually. She agreed to get out of the house incrementally. These were our suggestions, but she was agreeable to it. And so we first went to the park for 10 minutes. We took her to the park, and then we took her home. And we did that a couple of times, just, you know.
Small doses. And
then finally her goal was to go to the mall and get a pretzel with her husband.
Yeah.
And we came back to the house, and they did it.
Yeah.
You know, they went to the mall when the mall was completely packed, crowded.
Sure.
And her husband helped her. She went and got a pretzel. She eventually tapered off the Xanax.
Right.
And she got better. And as the husband and the mother got better, and the child's problems went away.
Right.
It was amazing. And the husband, he was diagnosed as being depressed, and he was on the couch a lot. And so what happened? You know, were you always this way? What happened here? And we found out that his dad, who he was really close to, died 4 years before we got into the house.
Right.
And he had been gainfully employed and everything, and you know, he just did not go back to work after his dad died, and kind of he was stuck in the stages of grief. Okay. And he was at the point where he was going to get Social Security.
Yeah.
He was just at that point, and I had enough rapport with him at the time, and where I was able to say this, and I said, you're in your 30s. You get Social Security now, it's basically all over. And he got mad at me. In the following session, he's shaking my hand, thanking me. He was putting applications in, and eventually he knew how to work on cars, and he started working on cars out of his garage. He didn't get Social Security. He worked through his grief, got out of depression, and their marriage improved, and the kid got better, you know? Right. And so for me, this is instructional. This is an example of if the kid were just coming to therapy in a clinical office and diagnosed with a disorder, whatever label, you know, we want to categorize
defiant or
the symptoms or whatever. She didn't need to get that label. We just needed to work with the family. We needed to help the mom and the dad in their relationship. This wasn't a brief intervention. This was one over time, ongoing. Right. But, you know, we didn't have to put the kid in the sick category.
Sure.
You know, we would have never seen these patterns. We would have never seen what we needed to do to help this family if we hadn't gone to the home. You know, we were just seeing what was happening at school and at the office.
Right.
Having the opportunity to learn all of this has translated a lot to my work with adults with addiction. Mm-hmm. And so I'm very grateful for the opportunities and you know, that I was given back then.
We learn so much from our experience, you know, so it's great to have that. I mean, to circle back, you know, you brought up, like, you know, you had a lot of well-educated kind of experts in the field, you know, mentoring you.
Who were also very experienced as well.
Right, experience and everything like that. And with their guidance and structure, you learn from your opportunity to implement.
Yes.
You know, the consultation helped you get you to do it well, but that you learned about the job, about how to be a good helper. There are definitely dynamics in this world of, like, it's not always the highest degree that, you know, teaches you something. Like I went to counseling and I cherish it and love it for mm-hmm. the degree I got and the opportunity it's presented for me. Right. But I learned all my stuff from my work. Life
experiences, but also I've learned most from the clients I've worked with over the years.
They teach you the most about yourself too.
And I owe a debt of gratitude to them.
Yeah.
Honestly.
Absolutely. And they teach you a lot about yourself.
Oh, absolutely.
You know,
they are the experts, mm-hmm. honestly.
Right.
And I learned that from my training as well, but that's verified by working with my clients. They are the experts. They may not know it.
Concepts become reality. So right. You know, they bring up these concepts that, you know, kid's the expert on himself, the parent, adults, you know, yeah, that makes sense cognitively, but right, then when it kind of viscerally makes sense, when it makes sense on a sensory mm-hmm. level, like through your experience, then it becomes more powerful and it becomes more useful for you. And it brings up an example that I have with a kid where this kid is constantly just engaging in self-destructive behavior after self-destructive behavior to escape a real significant discomfort in their body from emotional traumas. And the pattern that they were identifying was, or that we identified in session, was that every time they engaged in some type of self-harm, which I think is also similar to what happens when we self-medicate through medication, prescribed or unprescribed medication, is the pain is trying to process itself out. Okay. And so when you try to stuff it down or escape it or whatever, the pain basically says, I don't think so. You have to deal with me. And it's
a signal.
It comes back mm-hmm. harder and more challenging and more intense, more frequent. Mm-hmm. than if you actually face the difficult experience head on. And that's, I know that's challenging. It's easier said than done, but I would imagine that many people that have had these kind of similar experiences would identify that the more and more I try to escape and avoid feeling this way, it doesn't stop the pain, and it actually makes it come back more intense, stronger, more frequent.
And the drug, whether it's a painkiller or cocaine's even a painkiller, really.
Sure.
Does temporarily relieve emotional pain, mm-hmm. you know, powerfully.
Yeah.
It works.
Right. Or people wouldn't do it.
But it's self-destructive.
Right. And they end up, I would contend that they end up having to use it more frequently because when they are sober, they're left to those things and they come back faster. Okay, now you're off the drug. This is pain speaking. Now that you're off the drug, now I have the opportunity to throw up the alarms and say, you need to deal with me. You need to deal with me. That's and if you don't, and then they're like, oh crap. And they're running for that drug again. Maybe it was a week in the beginning. Now it's 3 days, then it's mm-hmm. 2 days, then it's 2 hours. You know, they're having to deal with this, you know, frequently, and any waking sober moment, they are in a lot of emotional distress.
That's right.
That they're trying to escape from. So family members of somebody struggling with addiction, what do you think it's important for them to know? What's important for them to recognize or understand about treatment in general, or just their role in it, or how they can, like, what they might be getting into?
Okay, first of all, I would like to really recommend people get acquainted with Al-Anon literature, if not the meetings.
Right.
There's so much resources for family members through Al-Anon, through adult children of alcoholics, even just going online, getting connected with people involved in those programs can be very helpful and help them to better deal with and transcend a situation where the person is resistant to getting sober. Also, trying to become more aware of emotional aspects and learning to detach from the problem and learn to have compassion for the individual. Learn how to be compassionate with oneself, but also with the one suffering, because everybody in the family is suffering.
Sure.
But the addict is oftentimes suffering the worst. And just being aware of that, getting educated on what works and what doesn't work, the enabling doesn't work, being compassionate yet firm. Mm-hmm. One of the kindest things you can do for a person is say no to them sometimes.
Set a boundary, right?
Mm-hmm. So boundaries are huge. And
those are things that if they went to Al-Anon, they would get a lot of help with, probably, right? That's probably something that they talk about a lot in Al-Anon meetings.
There is so much wisdom in Al-Anon and people that have learned to transcend their problems, even if the person's still actively using it. It's just, I can't say enough good things about that program. The meditation books, they can even get a sponsor that can help them, that can help give them the support.
That would be huge. Yeah.
The mutual responsibility of everyone in the home. I'd like to emphasize that as well. Just realizing that addicts don't come from perfect families, and that's not a fault finding. I want to get away from the blame thing.
Right.
There's one perfect ideal family, and from my vantage point, and that's the Holy Family, and so everybody in the household bears responsibility towards recovery. If the family members don't pursue that, sometimes the addict who is pursuing wellness and sobriety has to set a real hard boundary with their family and establish and declare their independence in a healthy manner.
Right. I think it's helpful for people to know that there are supports out there to help them through this, because one of the things that I definitely want to acknowledge is that it's super challenging. This is not an easy, even though the solution may be simple, it doesn't mean that the situation's simple or that it's easy. It just means that there are certain things that we can do to make things better, that are not super complicated, but it's more complicated and challenging in our own, in the way that we get in our own way. So that's where identifying those patterns come in and being able to kind of recognize those dynamics. So I'm appreciative of your time and your expertise and
thank you.
The passion you show. So thank you.
Thank you for having me.
I think the audience
Doug.
will thank you as well. So
all right.
Take care, everybody.